Continuing the conversation now about COVID-19 and the homeless with the president and CEO of Crossroads, Karen Santilli. Karen, what are you telling your clients in need right now?
We're telling our clients to the same guidance that we're all hearing. Stay a safe distance from each other, good proper hygiene, washing hands. We're asking that the folks in shelter to come back and stay in the same shelter every night so that they're not hopping from shelter to shelter, exposing their risk of contracting and or spreading the virus. For our folks in our housing program, same thing, stay in, proper hygiene, proper social distancing. It's a little bit more difficult for folks in shelter though.
Sure. Yeah, as the governor and plenty of leaders are forcing us to stay inside during these times, what are some of those challenges, that the residents face?
Well, the biggest challenge is they don't have their own home. And so they're in congregate shelter with many other people. And that's a big concern, obviously, with this virus. So it compounds their inability to really stay safe. They're medically vulnerable, far more medically vulnerable than the average population or the population that's housed. So we have these compounding issues that we're trying to manage. People with compromised health that are living in congregate shelters without the ability to social distance because they don't have their own home.
How is Crossroads and other providers impacted, by the economic effects of COVID-19 in this crisis?
From an economic perspective, we're concerned because we rely on the generosity of our donors and people in Rhode Island. Corporations, businesses are big supporters of our work. We can't accomplish our work if folks don't have the ability to donate. And so the negative economic impact of this is a huge concern for our donations that we rely on. We also have many of our clients that we're working to get employed, and many of them are struggling to find work or are afraid that they're not going to be able to go back to their jobs, which is going to inhibit their ability to pay their rent. So that has a big concern for us for the folks that we've recently housed that are just newly housed.
Do you anticipate maybe a higher demand, for housing during this time?
We definitely are bracing ourselves for an increase in homelessness. I hope we don't see it. I hope with the economic stimulus that the feds in the state are planning for, that we don't see that. But we have to be realistic. I do believe we're going to see more families and more individuals entering homelessness. We just don't know when that will happen. We're not seeing it right now. Fortunately, evictions and utilities there's a moratorium on shutoffs and evictions right now. And so that's really helping us keep people out of the homeless system. But when those end, there are going to be a lot of people in a very fragile place at risk of becoming homeless, more than usual.
Clients, residents, as well as staff members there at the places. How do you do your best to try to protect them, at all costs?
It's really hard. We have over 150 employees throughout all of our programs. We have thousands of individuals and people in our housing and in our shelters. We're doing the best we can with the resources we have. The guidance from our governor and Dr. Nicole Alexander Scott and the Department of Health folks have been really helpful in guiding us in terms of what we can say to people, keeping them safe, just really trying to be vigilant and keep on top of people with these good practices to stop any potential infections and spread of infections.
If you want to find out more information about the work that Karen's team is doing, as well as Crossroads in general, you can visit our website at WPRI.com or on our News 12 app.